Joining me on Baby Talk 360 is a Dominique Graff who owns Breath for Life First Aid Education. You can visit them on the web at www.breathforlifeinc.com, and they are located in Edmonton, Alberta, home of the Fighting Oilers. Dominique, how are you?
Great, thanks. How are you?
I'm fantastic, thank you very much. So on today's show, we are talking about family planning when you're having a baby. So this is kind of a unique type of thing because I'm in the stage where I'm about maybe a month away from we're having our child. So what I want to make sure is that my home is safe, secure, and the things that I thought about was maybe a first aid kit and maybe even going into some facilities and getting some CPR training for infants as well. Tell me what the most important thing when I talk about CPR and first aid training for people who may have not had that or thinking about that, why it's so important if you're having a child.
Well, I think a lot of people do want to go for that CPR course, and we get a lot of requests from new parents. But really when it comes to the little guys, they're not so high at risk for heart attacks and cardiovascular sort of issues. They're more at high risk for falls, wounds, getting into things like poisonings, and those types of things. So a first aid course is actually what I would recommend because, again, people want a really quick course, 4 hours, I'm going to learn to do everything, but they're really missing the boat. They're just getting CPR, and that's not really the biggest issue. Choking is another huge thing when it comes to the little guys. So I know it's more of a time commitment, but in the end, I mean, really, you're looking at your own child, and maybe a 16-hour course seems like, oh my goodness. But in the end, you're learning everything as they grow up developmentally throughout all the stages, and you have that for 3 years to carry it with you.
Tell me, if I'm a new parent, if I'm going to go sign up with you at Breath for Life, if I'm going to go sign up with you, what are some of the things that I would be learning that would really help me be a better parent in terms of providing a safer home?
Well, the best course that I would recommend is actually called a standard child care first aid. Like I said, it is a bit of a time commitment. It seems overwhelming, especially when you've got a new one on the way. But if you look at long-term wise, it's far worth it. Because in that course, you're going to learn basically from childproofing the environment all the way to dealing with childhood illnesses, and then, of course, some first aid stuff in terms of the little guys, the choking, the hazards, the poisonings, falls, things like that you will not learn in just a 4-hour quick CPR class. And you can carry that throughout all their growing years, and as they become toddlers and even older children, that course will apply.
So talking about choking here for a second, sometimes obviously it's not like an adult. We can tell if there's choking because we can get up, we can rattle, we can hit things as hard as we can make those noises. With an infant, obviously this is not the case, or a young child, this is not the case. They can't do the same type of things that we can. What would be something that you could talk about, a technique that can be used that would be taught through your course to prevent some, to deal with something like this if it were to happen, choking?
In terms of recognition for little babies, they do classically sort of do a textbook sign. They'll flail the arms backwards, and their face will become extremely distressed looking, and they'll turn either very red or very blue, and they won't be able to make a lot of noises. And so that's kind of a telltale sign because of that arching of the back, the arms going backwards. We call it flailing of the arms. That's kind of a telltale sign that, baby's having issues, whether it's because of choking or whether it's a breathing concern. There's something not right. What
is there to do immediate reaction? So, for instance, let's say I go to your course and I learn how to deal with these types of situations. Now, dealing with an infant, obviously, it's a complete different story than dealing with a full-size adult.
Sure.
So what would
the emotions involved too, right?
Oh, of course, So what would be, walk me through something over here as, let's say I'm sitting in your class right now, but walk me through something, not visually, but so I can take it in how you would deal with one of these circumstances right now. The baby is choking. What are the certain maneuvers that you would do? I mean, first thing I would think of is the Heimlich, but I think of that as a thing for an adult. What would you do in terms for a child?
Any child under 1, this is where the skills are a bit different. But basically, we'd set you up sort of like a scenario. Let's say, little Jimmy's sitting in his high chair, and you're feeding him, and all of a sudden, of course, they're not going to have the classic response like the adult, hands at the throat. They don't do that. They flail outward. So you've got the flailing of the outward. You've got that distressed look in their face. They can't cry. They're still conscious, however. So right away, you need to grab them in a football hold, head down, and give them some 5 back blows straight down between the shoulder blades. And they need to be, if you think about burping a baby, we're always scared, hitting a baby. But you've got to make that sort of thud noise to make it work. Otherwise, if you're just touching them, it's not going to expel that object. Once you've done the 5 back blows, you would sandwich the baby between your other arms, flip them over, and then between their nipples, you're going to give 5 thrusts using 2 fingers. And again, they need to be kind of, almost a jerking type emotion. And you're going to continue this until either the object pops out, baby starts to cry, wonderful, that wonderful cry we want to hear, or unfortunately, maybe baby does go unconscious, and then you need to move to more advanced stages of calling 911 and so forth. Wow.
Okay, so this is, when you say it like that, it is something definitely that people need to really think about this and sign up for a course like this. Now, obviously, the second big concern that we have with children, other than choking hazards, I always think about CPR. And for my course that I took, I remember CPR for an infant. We spent a lot of time doing that, and the differences between that and adult, and they're absolutely huge, the differences. So tell me a little bit about CPR for a child.
Well, again, this isn't people. It's funny how the public thinks, oh, CPR, but it's not the biggest injury or condition or illness, however you want to word that, when it comes to the little guys. Anyone under 8, typically, that's not the biggest skill that you're going to have to do. Certainly it is included in the course. We do go through CPR baby and child, and the skills are different for the age groups that are different. But the focus in terms of being at home, that's probably not one of the top of my list of skills that I would want to know. Unless my baby was diagnosed with some kind of heart condition, then of course I would want to know that. It is different. We're going to use fingers with the infant. We're going to use, hands with the child. However, the ratios are the same with the new guidelines that have launched. So that's good news. You don't have to remember all these different numbers for different age groups, so at least that's consistent.
Okay, so you're talking about the most important things to look out for then. If CPR is not on the list, not on the top of the list, let's talk maybe about the top 5 things that you would stress that they're the most important things.
For sure, choking hazard, that's a big one with babies, especially the ones under 1, because they don't have that gag reflex, they don't have the swallowing fully developed yet. Plus, they can't tell you, Mom, I'm having a problem right here, right? Because they can't speak. So you're going to have to really look at changes in behavior of your baby to be able to say, okay, there's something not right here. So choking is a big one. And then as they start to get into the toddler ages, they're walking around now, and they like to put everything in their mouth. So again, choking's right up there. But also they like to explore. So making sure we keep our chemicals high up and locked up so that babies don't touch it. Chemicals including medications as well, because something that's round and pretty and pink to a baby, oh, candy, right? They don't associate it as being a pill. So poisoning hazards, that sort of thing. And then falls, because as they're growing, they're clumsy. So they fall, and can they tumble down those stairs? So maybe protecting the stairs until they're really agile with the steps of walking, that sort of thing. So head trauma is maybe up there. I think that would probably be the most common, and then if we move into another one, might be some childhood illnesses. So now they're starting to get older, so maybe you're putting them into a preschool program, and they're starting to be around other children. So things that are contagious, and let's face it, kids are dirty. They put their hands in their mouth, they put their hands in their eyes, they put their hands in their nose, right? So what can they catch from other children? And that is covered in one of our programs that we have, so that when the child does come home after daycare, perhaps, you can say, oh, did they get lice, or is that scabies, or maybe is it something more simple like impetigo, or what is this? Because kids can transfer these things.
Yeah.
And then the last thing maybe would be, because children like to explore with their fingers, putting objects in their nose or in their ears, or sounds pretty simple, but you can get a pretty serious infection with an object stuffed up your nose and nobody notices it's there, sort of thing. So that might be the top sort of 5 issues, I guess, if you wish.
Wow. So this is pretty important. So let's talk about, you and I were talking before we went on air, and we were talking about, having a first aid kit. And you made a really great point that, a lot of the conditions that we're talking about right now, it's not necessarily, unless you've been trained on certain things, you're not necessarily going to use the majority of the stuff in a first aid kit. But then you had some really great suggestions about other things that you can put into a first aid kit that could be very important at the beginning. So, talk to me about what you think should be in a first aid kit if you're going to make your own first aid kit, and some of the things that you were mentioning earlier on.
Well, if we're looking, like with falls comes wounds, of course, because they fall, they scrape their knees. So you kind of want Band-Aids, making sure, again, with allergies, that you would be careful. Like I have a young one that's allergic to Band-Aids, so with her, we found out the hard way with, here's your boo-boo, plus here's a Band-Aid, and now you've got a nice rash. So making sure, of course, that of all allergies. If you're going to use some topical ointments. I'm not a big, huge fan because, let's face it, soap and water is the best.
Okay.
So a mild soap, not with detergent in it or smelling, just a very basic mild soap and water, and that is actually the best in terms of healing for wounds. Anything more serious that you're going to need to get more involved, then obviously you're going to need to seek medical attention. So whether it's bringing them into a medical clinic or activating 911, depending what it is. So basic Band-Aids of various sizes, make them fun with little cars on them or Barbies or that sort of thing because it's fun with the kids. You might want some what we call 2x2, so little small gauze pads that you can put pressure on it. So if there is a little bit more bleeding, that you can just put a little bit of pressure on there. Some other things that you might want to consider because of falls going on field trips is an ice pack. And a thing that I like to do, instead of buying everything commercially, what you can actually do is take an old sheet, cut it in a triangle. And we used to use these triangular bandages. I'm sure you remember, Aaron, when you took your course, when we tied up slings.
Mm-hmm.
So you use one of those, right? You put it in water. You wet this thing, totally wet. And then you make the classic Doughnut Bandages that we used to be taught in first aid courses. So you shape it like a little donut so it's nice and tight and put it in your freezer. And now you got yourself a wonderful, A, pressure dressing, B, cold pack. And when you take it out and you go on your field trip, it's going to stay cold all day. And so, it's inexpensive, and it's something you can just do at home. So that would be a nice thing to have in a first aid kit. Beyond that, tweezers might be a nice thing too, because kids can get into things with slivers and those sorts of things. Scissors maybe to cut up your gauze pads if you want to put them different sizes depending on the injury. But anything more involved than that, really, if you're looking at doing more treatment than that, then it might be something that tells you, maybe I need to see a doctor at this point.
Yeah.
Getting a little more involved with more, equipment and rolls of gauze, and this is getting really complex. So it should be really basic stuff in the home.
Yeah, we were talking about, too, certain phone numbers to always have in there. Maybe the poison control number if your son or daughter does get into any of these types of items that you were mentioning before. And what other numbers do you think would be important to have?
I always had our physicians, like the pediatrician's phone number. That was one place I always went first. And then you can always have sort of the local public health sort of clinic. They have those 1-800 numbers depending on where you live. They call them networks. You can have one of those numbers. The poison control for sure is a good one. 911 is always great, but if it's a poisoning, honestly, do the poison control because you get a much quicker response, and it's very specific, so they know right away what to do. 911 often even relays you back to the poison control center anyways when it comes to a poisoning.
That's a great point.
Other numbers, maybe just even your local police, depending on what's going on.
Yeah, that's a great point. You brought in some really great points here. So I want to tell everybody, Baby Talk 360 is a big proponent of making sure that people are educated and they go out there and they take these courses because it is something that's very important. So tell me about Breath for Life, first aid education. Tell me about the services you offer. Now, we know that we have a lot of viewers on the show who live across Canada and live in the States, and maybe they have relatives who live in Edmonton because you're based out in Edmonton, Alberta. And I know you were saying before that you guys do offer gift certificates and those types of things. And this is a great present if you know anybody who lives in Edmonton. This is a great present to get somebody for maybe a baby shower or whatnot. I think it's a fantastic present, actually, if you ask me. So tell everybody right now about Breath for Life.
So we've been in operation well over 16 years. My husband and I founded the company. We're both registered nurses. I actually practiced as a nurse before I went and decided to take this endeavor. And then it was so much fun teaching people. So I actually left nursing and I do this full-time now. My husband does work part-time. We have about, I would say, 14 or so instructors, contract